I'll heal.
Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. But it's Raya, so tonight let's take a little break from the daily news cycle and celebrate the people who have been working tirelessly on the front lines, as well as those working quietly behind the scenes. Charities and NGOs have been diligently raising money and aid for groups that have been hard hit by the pandemic and the MCO. But it's now been several weeks and I'm wondering whether a sense of apathy has started to set in, because often in crises we see compassion fatigue as a consequence of overexposure to the suffering of others. You become indifferent to the pleas of help, all the pleas of help, especially if you yourself have financial worries of your own. Sharaad, do you think that you've noticed to see this compassion fatigue set in?
Absolutely, Melissa, and I think it's just also the scale of which things are happening, right? So often somebody is in distress, but there are others who are doing fine and they can compensate.
Right.
Or things are bad at home, but there are people abroad who can somehow pick up the slack. But when a situation where this pandemic is global, the economic crisis is global, and even in your own neighborhood and your workplace, everybody's in distress in some way, because the question of who picks up the slack and so on and so forth becomes so much more difficult. Don't you think so as well?
Yeah, I think so too. I mean, often the people that you think need help are not the ones who are obviously in distress, and everyone's kind of stretched thin at this point in time. So joining us on the line now to help us think through compassion fatigue, we have Nurainie Haziqah Shafii, the founder of the non-profit organization Happy Bank. Aini, welcome to the show. Thanks so much for joining us tonight. Selamat Hari Raya to you.
Selamat Hari Raya.
Thank you. Selamat Hari Raya to you.
Thank you. Now, I want to talk a little bit about Happy Bank, because I understand that Happy Bank has been helping individuals and households directly. I mean, you yourself have been getting calls and messages from people who are, in desperate circumstances, who need help. Can you share a little bit of your experience working with Happy Bank during this MCO period?
Okay, I think this period of MCO actually teaches us a lot about patience, because honestly, throughout many years of doing social work, charity, I found that this period of MCO is like the toughest time. Because you see why it's the toughest time. It's really because a lot of people who previously, before MCO, people who are actually poor, who doesn't have food at home and things like that, are just there. They're already there. But during this MCO, it's getting tougher, because those who actually earn outside, actually have job outside, come back to this moment or this time without any food, because they get retrenched from work, they get suspended and things like that. So it's tough out there, and we are trying our best, our level best, to actually help as many families and individuals as we can. And apart from thinking that only Malaysians are impacted or affected by this, we realize that even migrant workers as well, undocumented families, are actually affected by this pandemic.
Aini, could you help us understand very briefly how Happy Bank works?
All right, so basically when we started, we were just wanting to help a lot of families in outskirts areas. We saw that there is a need where a lot of families in villages, for example, are not getting the attention. So when MCO kicks in, when MCO kicks in, we realized that families, even in Klang Valley, outside of Klang Valley, in Sabah, Sarawak, they need more help, right? So what we do in Happy Bank is we provide direct food. We are actually a food bank where we provide the food, basic daily necessities to to these families straight to them. So we hire delivery men, movers, to send food directly to them so that they don't have to go out to buy food. They have to think whether they have money to buy the food, and secondly, how to go out during this MCO period.
And who funds these projects, and how sustainable is it in the long run?
All right, I'm so proud to say that during this MCO, it was the public at large who actually fund us. And in fact, I can say that every week when we do our audit and we display to the public on how much fund that we get and how much fund has been spent, we are so proud that we almost reached about 500,000 entirely by the public. And so from this, it's not a project of a long run. We are entirely working towards helping families during this MCO period.
Okay, yeah, so helping kind of bridge, provide some kind of bridging help for those who really need it the most. Aini, you said that, you've been fundraising to the public. Are you concerned that, the longer this pandemic stretches out, that people who may have been more selfless in the beginning are now perhaps facing some kind of compassion fatigue? Is that something you've started to notice?
I have to totally agree with that. When MCO started on 18th of March, we thought that it was just like a 2-week kind of break from work, from our daily routine. But we realized that it stretches every time. It stretches every kind of week, every phase. And at one point of time, even my team, we were very tired because of the everyday applications that we get. We have lots and lots of people expecting us to send food to them. We are expecting some help, or we're expecting people from Sabah, especially for us to help. It's actually very, very tiring, I can tell. So our team are also tired, and imagine the people out there who are actually waiting for food, waiting for all these basic necessities, and that's very, very tiring.
Yeah. So I'm just wondering now, now that we know that it's going to stretch on for a little bit longer, how are you kind of appealing to everyone's sense of duty, sense of charity at this point in time? I know during perhaps Ramadan and Eid al-Fitr, people are a little bit more giving, but how are you planning to help going forward?
All right, so we have been thinking about this as well. You see, the problem right now that we are addressing is basically a daily kind of necessity, which is food. Mm-hmm. But often during those days, during this MCO period, my team and I were thinking on how to help families that are in our database to actually go back to the ground, get their job done. Those who are actually retrenched, for example. How do we ensure that they can go back on track? Right. But that's our difficulty and our challenges right now. We are not able to help them in terms of that. We're hoping that probably corporations, organizations, even the government or agencies come forward to actually offer some help as well. Okay. We have tried our very, very best to actually keeping up to whatever needs for these families, not just food, but also necessities like diapers, milk, formula milk, for example. But it's not enough. People have to survive longer than that.
Right. I want to ask you, though, it seems that, you're doing a laudable job, but it perhaps not, your remit, or in fact, your responsibility to do job creation. Job creation is a difficult one. I just want to ask you how, when you get these applications and you interact with the people that you're serving, do you sense despair out there, or people optimistic that there's a corner to be turned on this situation, or are they getting really desperate? What's the feel out there?
I'm honestly, I actually can tell you a bit more different, because you see, people or communities that we serve, for example, in Sabah, it's very different because they are already in that stage or in that situation for quite some time. We were just helping out more there. But in Klang Valley, in Peninsular Malaysia, especially in the central area here, the problem is people want to go back to work. People need to go back to work because they have they have responsibilities that they have they got. So that is actually what worries a lot of people when we talk to them.
Right.
You see, like Happy Bank, what we do is we're not just sending food to them. What we also do our database to ensure that we get all these people with their details. And when we talk to them, these are their worries and also their concerns. Whether they are able to go back to work, what's going to happen after MCO finish, what's going to happen in 1 or 2 months to come.
Right.
So that's a big struggle, to be honest.
Whether they can continue putting food on the table, right? I want to ask you, because you recently quit as the head of PKR Sri Kandi, the Women's Youth Wing, and you also resigned from the Petaling Jaya City Council. I'm wondering whether, you still have faith in politics and in the government as an avenue to help people, or has that faith dissipated?
I didn't expect this question to come, but yeah. I know it would come probably, but to be honest, that's just like my political career that I see. But I think it's about having faith in the entire country. I have faith in my country. I love my country. I quit because I don't have faith in the party anymore, but that would not stop me from doing things that I need to do. So it actually won't stop me from doing all this groundwork, because that's what I'm good at. So I believe that wherever I am, whatever path that I choose, it's the people and also the country that is like my number one priority.
Right. Last question from me, at least. NGOs are doing incredible work, but in the early days, there was a concern that only the police or the army of the government agencies should be involved in the distribution of food and aid and such. The balance between what NGOs do well and what government does well, have you found that there's synergy now between government and NGOs in delivering the necessities for Malaysians?
During the early stage, when it was like a big hoo-ha on government taking over, feeding the people, sending aid for the people,
right.
I felt a bit skeptical. But right now, I can see much more synergy between the government and the NGO when we are open to working together. I think the most important thing is about being open to working together instead of, during this pandemic, right, or during this kind of crisis, it's about working together. So I always believe in that. And I see some differences and changes, especially to a lot of NGO, who are willing to work with the welfare department, for example, with other agencies as well. Yeah.
Well, because NGOs like Happy Bank, have access to people on the ground. You mentioned the database, that you're updating the database. That information could be of such value to the government to reach Malaysians in need. Aini, thank you so much for speaking with us today. We really appreciate your time, and Selamat Hari Raya to you and your family.
Selamat Hari Raya.
After this, we're going to speak to activist Hartini Zainudin from Yayasan Chaukit. So stay tuned to consider this. Thank you for staying with Sharaad and I on Consider This for our special Raya episode. We're addressing compassion fatigue tonight on the show. And joining us on the line now, we have Datuk Dr. Hartini Zainudin, co-founder of Yayasan Chaukit, and she's an activist, a long-time activist. Tini, thank you so much for joining us on the show tonight. Selamat Hari Raya to you. How are you?
Selamat Hari Raya.
Selamat Hari Raya.
Hi, I'm good and well, thank you.
Tini, earlier we spoke to Aini from Happy Bank about charities and NGOs that have been diligently raising money and aid for groups that have been hit hard by the pandemic. Now, can you share a little bit with us how it's been like for you and Yayasan Chaukit particularly?
Well, it's been rather intense, and it was already intense to begin with. But it's been a constant updating of cases in terms of documentation, and just getting our people asking for help every day, consistently, constantly. I think we have sort of a system pat down now with food distribution because we're working in collaboration with other NGOs and organizations and individuals. So there's a system now, like, how we do things. But for the cases where you need child protection or you have, a mother about to go into labor and delivery, which is every day, that gets very intense and this thing. But we have a system as well. We work with other NGOs. So I think it's good that we're not doing this by ourselves, although we do family distribution every week by ourselves.
Tini, I want to ask you, I mean, you already have your traditional target groups, as it were, people that you have identified, groups that you've identified for services. But have they, in your view of what's happening, new communities or new groups that are emerging as a consequence of the MCO and the pandemic? Are there new groups that are in need of help, and how are they reaching out to you?
Well, I think there's a couple of ways in which we're doing. One is through referral, which is quite normal because we work very closely with the other NGOs. A lot of it is through social media, which is also sort of normal. But I think what's different is the fact that the ask for help is coming from different states as well, and it's a lot of coordination that has to happen, and a lot of networking about who knows who and who can help and who's in this area industry. So in many ways it's sort of the same target group, but in some ways it's different because we're actually doing nationwide work and help is asked from different states, which we didn't usually get those cases maybe once in a while.
I see.
So yeah, there is a difference. It's more people in more areas, I guess, and states asking for help.
Tini, tonight's show is about compassion fatigue, and I want to talk about this from two points of views. One from the people working to raise money to help those in need, and the other from the perspective of perhaps the public who themselves are overexposed to pleas of help and maybe suffering from financial distress themselves. Can you talk about compassion fatigue from those two points of views? One from particularly from a charity's point of view. Are you tired of having to kind of rally during these difficult times?
Yes. If you're speaking, okay, first of all, it's not that simple and it's not as easy. In fact, I'm suffering from compassion fatigue as well, just having to ask people over and over again. And yes, I have a group of people that we ask and a group of donors that have known us because we've established this relationship and built a relationship over long periods of time and years. And so it's sort of easy to pick up the phone and ask for help, but you still have to fill out those forms if they're corporate donors, although they make it a little simpler. But they're helping. A lot of the corporates are helping many communities, which I think they would not have reached or have worked with before prior to MCO, but because of the emergency and the immediate need and crisis that a lot of people and communities are in, the corporates I've seen are really generous in trying to help everybody, and sort of the requirements to fill out, the forms that you fill out are a little more lax. It's not as tough as it usually is. So you see the help and the generosity, but they will tell you straight up front, a couple of them, they cannot give you as much as you would like to get because they're helping a lot more people. So that pool of funds is the same, but the donors and the people who need are much more.
Right. So, Tini, I want to ask you this, and this is, this often is the tug of war for people in this area providing a welfare, which is that, do you help more people, but, in very small ways, or do you help, fewer people, but more intensely, deeper? There's a trade-off, isn't there, between broad-based support and that which is more intense and perhaps would be more empowering in the long run?
Yes, for sure. So for me, for example, just personally, helping pregnant women in crisis, for example, who can't afford, to go to the hospital or need help or get volunteers to go with them to the hospitals or whatever it is. We tend to help more people than we usually do because there's so many. But at the same time, the cases where I had a case on incest and domestic violence, for example, that would be something that would is much more intense and much more in depth, and something that's been going on for weeks. Yeah, and she finally got on the plane today. She and her child, and that was weeks of things. So I'm sorry, but there is no way I can do 3 of those cases or 5 of those cases at the same time. It's just one case where it's very intense and there's a lot of different moving parts where I can do one. But in terms of the number of people we can help in terms of donations and volunteers and helping pregnant mothers, okay, that we can help a lot more. But it's not in depth. It's something that you just do. You give out the funds and you have people to do it. Sort of, yeah. So, and it's very draining. I have never been this busy and this drained emotionally.
Oh.
Yeah, it's difficult.
Well, what recharges you, Tini? Are there, I'm sure that it will be draining for anyone in this line of work. What keeps you recharged?
Well, first of all, I think there's a good network and mix of corporates and individuals and organizations and just groups of neighborhood communities, just pulling together to try to help solve the problem. So there's more of us, and so you can sort of delegate. And I have taken days of rest where, I'm like, I'm done, I am fatigued. I need a day off. And so everybody's like, we'll take, we'll carry your slack for this day and you can come back tomorrow refreshed. So I've had to do a couple of those days, because I'm just wiped. Right. But like I said, now that there's a system and people are in place, you can do the food distribution, you can do the, finding the money to help, pregnant women or the child who needs help or who needs to get removed and moved to a different alternative shelter. We can do that. But the individual cases, the intense domestic violence, the rape, the incest, those cases, I can
I want to ask you, because of the sheer scale of the crisis, often people turn to government. Government has deep resources. Is government helping you? What kind of help could you get from government that you would like to put out front and center?
Well, the first day in itself of MCO and stuff, we actually had a meeting. I think it was 3 days later. We actually had a meeting with the Minister of KPWKM to talk about the fact that we were looking at food distribution and helping the homeless. So she was there, and you can reach out to the ministry and the sort of the higher officers and the minister herself if there's an issue. And there were lots of hiccups in the beginning, so that was good in terms of coordination and trying to get to do. But I think the government, I don't work directly with the government. I would sort of write letters to the Ministry of Health and say, can we do this, or can we get help with this? And we sort of also offer our help to the ministry. So there is communications between the different ministries and us in terms of wants and needs. I'm not saying that we're cut off completely, but there are certain things because of the nature of the work that we're doing, whether we work with refugees or migrants or marginalized groups of people or pregnant girls who's having a child born out of wedlock, those cases, that's a little more difficult to go approach the ministry. And I think that's more my bias than anything else. Maybe I don't know. I'm a little more biased and I'm a little more sensitive to go, call up and say, can you help me with this case, right?
Okay.
So I wish I could tell you. I don't really know because I have my biases.
Well, okay.
But they've been there from day one.
In the last minute that we have left, Tini, I'd like to ask you, for all of us watching and perhaps feeling a little bit tired or overexposed to all the pleas of help and facing some kind of compassion fatigue, what's your message? How do we all rally together and remember to be a little bit more selfless in our daily lives, especially as we know this pandemic is going to stretch on for quite a bit?
I think the first thing I tell people is we do what we can, and we do so sincerely. And if you're tired, this is why I say, please go to sleep, wake up in the morning and try again, because we can't leave anyone behind. Right. We simply can't. We just can't. So that's my message.
Well, thank you so much for speaking with us, Tini. We really appreciate your time. Selamat Hari Raya.
Selamat Hari Raya.
And
Bye.
keep up the good work. That's all the time we have for you on this episode of Consider This. I hope you're having a meaningful Ideal Fitri. I'm Melisa Idris, with me Sharaad Kuttan, signing off for this evening. Selamat Hari Raya. Thank you so much for watching and good night.
sanak saudara mereka. Namun ketika PKP bersyarat yang
Halo. Tak ada. Cuba bagi off air ni. Saya pun tak tahu dah. Still lagi PC Tak, saja nak tengok. Uncut 1, 2, 3 ni semua fan dia akan queue. Nanti second block pun still